morning everyone. I am Dr. Neelabh Agrawal, Assistant Professor in Department of General Surgery at Amanur Lohia Hospital. So today we are going to demonstrate the operative steps of a case of hydrocele. So we will be operating a young male, 30 years of age, with a small left hydrocele. So now we will be demonstrating the operative steps. So we will be giving the cord block. So we will first hold the inguinal ligament here, the cord here. We lift the cord. We'll take a 10 ml syringe. We'll take a needle of 5 ml so that it does not injure the vessels here, and we'll give a cord block. We have taken 2% lignocaine and we have diluted it by 50%. So we'll be just giving a cord block. बस एक सुई लगेगी आपको. Normally we use around 15 ml of lignocaine and we dilute it by another 15 ml of saline so as to make it around 30 ml. So we have given the cord block and we'll just give a gentle massage so that the effects come in. Some people do prefer this block at the base of penis to anesthetize the posterior scrotal nerve. So we'll just give it just below the pubic symphysis. So we will एक और इंजेक्शन लगेगा आपको. बस 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 ढीला छोड़िए बिल्कुल टाइट नहीं करिए. नहीं ढीला छोड़िए, बिल्कुल ढीला छोड़िए. बस एक इंजेक्शन का दर्द है, उसके बाद नहीं होगा. ठीक है. This will probably block the posterior scrotal nerves. So this is the median raphe of scrotum. This is the left sided hydrocele. So we'll hold the scrotum firmly, and we give an incision around 3 to 4 centimeters lateral to this raphe. So we will give a local hair also in the local layers on which we will give the incision. So we will give the local hair. बस एक सुई लास्ट लग रही है. So you can see the local will go just beneath the skin layers. बस रुक जाइए, परेशान नहीं हो गया. देखिए ये इंजेक्शन अभी हम लगा दे रहे हैं. अगर ये नहीं लगाएंगे तो आपको पेन रहेगा. बस लास्ट है. So as you can see, we have given the local at the incision site also. So we'll keep holding it like this only. We will not leave the scrotum. We have waited for around 5 minutes and we'll give the incision on the local side around 4 to 5 centimeters just lateral to the median raphe on the side on which we have given the local. So we'll just give a gentle incision over that side. We'll deepen the incision. So we'll be opening all the layers of scrotum. We'll start from skin, then external spermatic fascia, then cremasteric muscle and fascia, internal spermatic fascia, and then we'll reach the final layer, tunica vaginalis. We'll do the inversion of tunica vaginalis only, the parietal layer of tunica vaginalis. So layer by layer this will keep opening. As you can see, we are not bothered about this bleeding, that we'll deal with it later. Okay, so we have deepened the incision enough and you can see this spout. So we have to be very careful that our blade does not puncture tunica vaginalis, otherwise it will be difficult to evert the sac. Now we'll use the scissors and forceps and we'll do the dissection with the help of scissors. So we'll lift the structure and we'll go inside every layer. You can see we have almost reached tunica vaginalis, and this edematous fluid is our local anesthesia that we have given on the local site. And your assistant will keep holding the sac we'll try to lift. So you can see these are some layers. We'll go layer by layer. We'll not hurry in this case, because if tunica vaginalis gets ruptured, our work will be a little difficult. So this is our final layer. You can see this white shiny layer filled with fluid. So this will be our final layer. So this is the parietal layer of tunica vaginalis. So our aim is to dissect this sac of the other layers of scrotum. So the most easiest way to dissect this off is by the finger dissection. We will use our fingers and roll it over in the whole of scrotum very gently, so that this layer gets separated from the other layers of the scrotum, and then we'll try to deliver this sac outside the scrotum. Bas ho gaya. And then we'll give a gentle massage and we'll see that this sac gets delivered. Hold it, keep holding it. Okay, so this sac gets delivered. Still on the posterior side, you'll see that some layers of scrotum are still attached. So we'll use a mop dissection. So you can see these layers are getting off this tunica vaginalis. You can see layer by layer we'll dissect till we get a full view of the cord and sac separately. Bas. So we'll do a gentle massage, gentle dissection, blunt dissection. Just mop it for a clear view. So still we are a bit away from the cord. You will see all the structures going down till we are left with the cord only. This step is very important and we often underdo this step of dissection whenever we are in a hurry. So we often underdo it, but this is a very important step. So now you can see that this is the cord that is separated from this sac. This is tunica vaginalis. So now what we'll do, we'll just rupture this sac and hold its edges. Okay. We'll give a stab. We'll give a stab here so as to puncture. So you can see the clear fluid comes out of this, and we will hold the edges with the help of 2 mosquito forceps. One, hold this, and the other. So now, with the help of scissors, we just cut the sac on both sides. We'll keep in mind that we do not damage testis at any point. We'll just use the fingers, so bus. So we'll change our orientation like this. Hold करो. ये ऊपर थोड़ा सा. हाँ yeah. So this is shiny testis. So we'll just use our fingers to see before cutting the tunica vaginalis layer. बस. You see the epididymis, and now we have dissected enough, so we'll just do the inversion of sac like this. Okay. So now we'll take this bite of the tunica vaginalis and stitch it to the bottom. So we'll take continuous bites on this layer of tunica vaginalis, keeping in mind that we don't pierce the cord structures. take a continuous suture. We prefer chromic 20 suture or 30 depending upon the thickness of the sac. We'll reopen this artery forceps and hold it at a lower place, as much lower as we can. Okay, stretch. Okay, so these are the layers of tunica vaginalis. We'll take continuous bites on this layer. ये हटा, वो सिंगल वाला सूचर उसमें ना है, उसको पकड़ा सके। हाँ, so we'll keep taking continuous bites, and the most important point to be kept in mind at this stage is that we keep at least one finger breath opening at this stage so as to prevent cord edema. If we close the sac very tightly, then in the post-operative period it can cause cord edema. That will be bad for the patient. And so we just tie our last suture here. So in this way we have averted tunica vaginalis layer, and we'll cut the sutures here. Okay, so the next step is to deposit the testis in the exact way in which we have taken it out of the scrotum. So this was our anatomy, and we'll deposit it exactly in the same way. Hold this scrotum, Udar sir, and we'll slowly guide testis. So because we took a very small incision, so it is sometimes difficult to put the testis back, but we'll gently push it inside the sac. So we'll again try manipulating it, and just give a gentle traction. I don't want to extend my incision in this case, so try. So it has gone back. Okay, so we'll stitch these layers with chromic 20 RD forceps. So we'll just hold. So we can see that this testis is quite comfortable inside the sac. We just hold the edges of the layers of scrotum like this. Normally we can place a drain also from this point. So if we need to place a drain, or if it is a pyocele, we'll insert a finger and we'll just give a local hair and put a corrugated drain from this side, and leave the corrugated drain just behind the testis. In this case, I don't think we have achieved complete hemostasis. We'll not put a drain. So we'll just close the layers. We'll just close the layers of scrotum in a continuous fashion with this chromic only. Open this artery forceps. Open this artery. Hold this. So we will take continuous bites over this there. Keep a suitable distance from the skin, because so that we can apply a good skin after traction. Skin will take from nylon sutures that we conventionally take. So we are taking continuous bites of all the layers, and we'll take the final bite behind the artery forceps. Open the forceps, open the artery. So this is our final suture. Okay, so we take 3 knots. Yes, cut. Okay, so we are done with everything, just the skin part is left. So we can see that this tissue should go comfortably inside the skin, and then we'll take 2 bites of the skin nylon. So taking skin sutures on scrotum is a bit tricky work because scrotum has folds. So what we normally do is that we take 2 bites at the end of the skin incision, like 1 bite here and 1 bite here, and then we'll use those sutures as a traction. Then after stretching the skin of the scrotum, then hopefully the sutures come perfectly. So we are taking a mattress suture here. Some people prefer simple sutures, some people take sutures with silk also, but we normally prefer nylon 3/0, and a loose mattress suture will work the best. That will give a perfect skin approximation. Cut it and hold it. Thoda bada. Hold it. So we'll hold this one suture at the end with the help of artery forceps. We'll take a bite at the end. So we'll see where our angle is forming. Like this is our angle. So we'll take 1 bite here. Take mattress sutures. I generally prefer mattress sutures in the scrotum because I believe that it gives a perfect result. So we'll hold this suture also and cut it. So now you'll see that we'll hold these 2 forceps as a traction. We'll use these 2 forceps so that the skin becomes stretched and our sutures will come perfectly. If we don't stretch the skin, the sutures might not fall in place, and there may be post-operative wound dehiscence, etc. as a complication. So we are trying to get a perfect skin for this patient. Taking our last bite. So you can see that these sutures come perfectly and the skin is approximated edge to edge. Cut. So we'll cut all the ends and leave it. इसको ऊपर थोड़ा सा कट दो. Okay. So we'll now show you how this skin has come. Okay. So this is the most perfect way of skin approximation. You can see that we don't see any raw edges in the skin. So we'll now do a coconut dressing for this patient, a compression dressing, and we'll call the patient for a dressing on day 3. हो गया सर, बस ये हाइड्रोसील हो गया. लाओ उस पे